Dr. Campbell and I wanted to come on today. We want to talk with you today about how you will know if you've got an oral problem that's directly affecting your systemic health.
You know, your mouth talks to your body and your body talks to your mouth. And so there's clues that your family practitioner can identify in your visit that might need to be seen by the dentist. And there's things the dentist can see that might need to refer to the doctor. So we want to make sure that everybody is aware so that we're all talking on the same page. So these are some lab tests that I sometimes use to help me as a primary care doctor assess whether or not the patient needs to see a dentist. So these labs are drawn from Quest Laboratory that now owns Cleveland Heart Labs. So these are considered high-level cardiovascular screening labs. And these 6 tests on this panel are called the FAIHM panel. So this is another test that I find helpful. These 2 markers are called galectin-3 and proBNP, brain natriuretic peptide. So these are little protein molecules that can come from heart muscle. If your heart muscle is stressed, these will leak into the body. So what are some things that cause heart muscles to be stressed? Well, the first thing that I think about is wisdom teeth. And I'll show you in a little bit about the energetic connection between the wisdom teeth and the heart. But it has come to my practice multiple times where people have problems with their wisdom teeth and these NT-proBNP numbers are elevated. So when I see this marker elevated on the test, I think about, is it heart muscle? But is it heart muscle as a primary problem or heart muscle as a secondary problem coming from the tooth? And so, believe me, teeth are easier to treat than hearts. So getting to the dentist, if that's a problem, can really make a big difference. Another thing that can make the heart muscle stressed as a secondary problem is sleep apnea. Mm-hmm. If you go to sleep at night and you do not breathe normally, and you do not get oxygen to your brain or to your heart is like choked. Every time it tries to breathe, it's choked. And that stresses the heart muscle. I can see these numbers go elevated. And when they're up, I always get a sleep study on the patient. Unless I go to the dentist and they take an x-ray and say, oh, you have a wisdom tooth abscess, that's easy. I don't need to do a sleep study. But if there's not an obvious reason, I see these numbers elevated, the patient deserves a full evaluation of their sleep. Another thing that can make these numbers elevated is mineral deficiency. Calcium is necessary to make all muscles contract, and magnesium helps them to relax. If you're deficient on magnesium, everything gets stuck in the cramped position. And so you may have cramps in your fingers when you're working on the keyboard, cramps, spasms in your neck and neck pain. Personally, I get leg cramps in my calves at night if I don't have enough magnesium. Your bowels will cramp in the locked position and not move. Constipation can be a symptom of low magnesium, and heart muscle stress enzymes can be a symptom of low magnesium. The next thing we want to talk about is a mouth miracle molecule called nitric oxide. Nitric oxide is so important, it won the Nobel Prize, right? It is one of the very few molecules in our body that is a signaling molecule that's also a gas. Now, don't confuse this with nitrous oxide, the laughing gas that they put the dentist. That's a different molecule. This is nitric oxide. And this molecule does so many things. It's books and books and books have been written just about this little tiny molecule. And one of its major jobs is to help dilate and open blood vessels. So if you don't have nitric oxide, those vessels are cramped and restricted just like they are with low magnesium. But guess where you make nitric oxide? Your sinuses and your mouth. The enzyme that is responsible for making nitric oxide is made by bacteria that live on your tongue. If you do not have a healthy tongue, you do not make nitric oxide synthase. If you don't make that enzyme, you can't make this miracle mouth molecule, and you can end up with high blood pressure and heart muscle stress from low nitric oxide.
This is one of my favorite soapbox topics in dentistry, because when we recommend mouthwashes to people, it's going to kill the good and the bad bacteria. So it's going to lower that patient's ability to make nitric oxide. And there's two ways to make nitric oxide before age 40, but after about age 40, one of those ways shuts down, and then you really are reliant on the bacteria in the mouth. And that's why they think chronic disease processes start after age 40. So if you are using mouthwash every day, maybe you want to consider how necessary that is. If you have a hot date, is what I tell people, maybe you use it before that hot date, unless you have dates a lot. But it's something to be used very sparingly, not something necessarily for everyday usage.
Right. And remember, mouths are for eating, noses are for breathing. And so if you're one of the people that watches TV like that and sits on your computer with your mouth open like that, you have a problem. You are doing that to open the airway, and there's likely an anatomical problem where your body is not getting air. You're opening your mouth to increase oxygenation. So when you open your mouth, you change the pH and the hydration status of your oral cavity. That makes it unfriendly for the happy bacteria that are supposed to live there, and it doesn't allow airflow of oxygenation to get through the sinuses where a bunch of nitric oxide is made. So you need to have your mouth closed while you sleep, and you need to have your nose open so you can breathe. For me personally, my dentist, Dr. Dayries, has me mouth taping. So I put a piece of, literally, of tape, almost like a Band-Aid, across my lips at night so that I can keep my mouth closed when I sleep. And it makes a huge difference in how deep and restorative my sleep is.
Thanks.
So this is another laboratory test that I can do. Now, I'm one of a very few handful of family practice doctors that uses salivary diagnostics in my office. There's not even enough dentists doing salivary diagnostics, in my opinion, but this is a spit test. So when you come to my office, if I see any of these fire panel labs that are elevated, right, and I think that the patient has a dental problem because these are elevated, often, if they don't already have a dentist that they're seeing on a regular basis, I will ask them to do a spit test for me. So simple, we give you a little test tube full of salt water, you swish it around, you spit it in the cup, and we send it to the lab. And so these are looking for high risk, moderate risk, and low risk pathogenic bacteria, bad bacteria, if you will, that are associated not only with gum disease. This is why the dentists like to do them, because these bacteria can cause gum disease, such as periodontal disease and wiggly teeth, even tooth loss. You can have your teeth fall out if you have enough of these bad bacteria. But I do it not because I'm doing the dentist job. I do this because these bacteria are also associated with serious medical conditions, such as atherosclerosis, hardening of the arteries, heart attack, stroke, cancer. Mm-hmm. Mm-hmm. Sadly, I lost my little sister 2 years ago to pancreatic cancer. And she was not a health nut by any stretch of the imagination. She was a smoker, and she liked to have her cocktails every day. And when I saw her in the hospital shortly before she died, she had terrible periodontal disease. Her husband told me that the last time she had been to a dentist or a doctor for any reason was 25 years prior, when her daughter was born. So she had not seen a dentist for 25 years. She had terrible periodontal disease. Her gums were receded. You could see her tooth root. She had ugly plaque and terrible breath. And she got pancreatic cancer and died from pancreatic cancer within just a few weeks of her diagnosis. After she passed, I did some research and realized that periodontal disease could have been a trigger for that pancreatic cancer. So I am more aggressive now at helping my patients to identify, do they have mouth bacteria? Because if I can identify them early, get them to their dentist might be able to save their life by clearing these bacteria. It's not always easy to do, Sometimes it requires periodontal care, such as scaling and planing. It may require some targeted antibiotics. It may require antibiotics by mouth. It might require some mouthwashes specifically prescribed by your dentist for a short while to get these bad bacteria gone. It might require topical antibiotics. You've seen an Invisalign retainer. Well, they make a perio tray that's similar to that, except it's got a little channel where they can put an antibiotic gel, and you put those things in your mouth a couple times a day with antibiotics to help clear away these bad bacteria. The dentists tell us that when we're interpreting these tests, that if we take this black line, any patient with a bacteria count above the black line is in serious trouble. These high-risk pathogens are the ones that alone or together really play havoc on the gum tissue and really make it red, inflamed, irritated, bleedy, and bad breathy. So you don't want to have any of these bacteria, but these are the worst ones. This person had some amount of this bacteria, and any amount can be bad in some people. Some people have immune systems that sort of overreact. They have just a little splinter, they get a big pus infection. They have just a little bit of a bruise, of an injury, they get a big bruise. Some people have just a little bit of bacteria and have a big inflammation response.
Can I mention something?
Please.
In a minute. I was just going to say, more and more we're realizing that the type of bacteria in your body really matters. It's not about getting rid of all of them. It's about trying to expand on the ones that you want to have living in your body, the so-called old friends. There's some that we need to have in our body. For every 10 bacteria cells in our body, we have 1 human cell. And so maybe you might also mention I mentioned not using mouthwashes like crazy, but I also like toothpaste that might even have some prebiotics, which helps seed the mouth for certain types of bacteria. And also sometimes you'll see that there might be some corresponding gut issues when you have these inflammatory or these types of bacteria that cause this type of inflammation you're talking about. So that's
right. When we talk about cutting the head off the rest of the body, right? So many people today are aware that the gastrointestinal tract is so important for our immune system, as well as our digestive health and our immune health and our emotional health. We make more serotonin in our gut than we do in our brain. So anxiety, depression, these can all come from our gut. Well, guess what? The gut starts at the lips and ends at the anus. And so if these mouth bacteria are unfriendly, I pretty much guarantee the patient has unfriendly bacteria in their gut, lower down as well. You can't have likely a healthy mouth if you don't have a healthy gut, and you can't have a healthy gut if you don't have a healthy mouth. You're swallowing these bacteria every time you swallow. They're getting down in your GI tract. Interesting to me anyhow is that different bacteria like to live in different places. So the bacteria that live inside your nostrils are not the same bacteria that live in your gums, or not the same bacteria that live in your armpits or in your rectum. But when there's inflammatory bacteria, they can make inflammation signals kick off anywhere in your body. So we don't like them to be present. And a DIY thing that I think many people can do is, number 1, eat more vegetables. When you get those antioxidants, you should be eating 9 servings of vegetables a day. 3 that are leafy and green, 3 that are brightly colored, and 3 that have sulfur in them, such as broccoli, cauliflower, kale, cabbage. So you want to get 9 servings of vegetables a day. If you can do that, often these bad bacteria start to go away. Also, Dr. Amy mentioned a prebiotic. There's a polyol called xylitol that is a sweetener that is wonderful for your mouth bacteria. These bad bacteria do not like that. They like sugar. They like old-fashioned sugar. But the friendly mouth bacteria that you want, your old neighbor friends, the ones you want to have come into your dinner party, they like xylitol, and they grow very well when we have xylitol around. Just do me a favor, please. I have 2 100-pound puppies at my house, and xylitol can kill your dogs. So please keep your xylitol toothpaste. Don't ever use it to brush your dog's teeth. It's good for your mouth. It's great for your teeth, but it's not good for your dogs. So this is another test that we use that I can sometimes tell the patient has a problem they might need to see their dentist for. And this is called a 4-point cortisol test. So your adrenal glands are your body stress fighting glands. They live on top of your kidneys, and their job is to make adrenaline and cortisol. We have a diurnal rhythm. Our day and night biorhythm is in part determined not only by the cycles of the sun and the moon, but also by our rhythm of cortisol. And in the morning, a few hours before we wake up, our cortisol should be high, and then should gradually drop as the day progresses so that by bedtime it should be very low. Cortisol is our body's natural anti-inflammatory, so without it, you tend to have a little more inflammation in the evening time. That's how come kids' fevers go up at night. That's how come our joints hurt more at night, because we have a little less cortisol than we did during the day. But if I measure a person's cortisol, just at one point, I take a snapshot of a movie, it's hard to figure out. So I need at least 4 scenes. So I do a morning, noon, afternoon, and bedtime cortisol. And I put them on the graph, and I see, is your cortisol high when it's supposed to be high and low when it's supposed to be low? If your cortisol is nailed to the ceiling first thing in the morning and it's high off the chart, that almost always tells me you have sleep apnea. That you are not getting oxygen, your body is struggling and fighting, and your adrenaline's too high, and when you wake up in the morning, your cortisol's off the chart. So that patient deserves an evaluation for sleep apnea. And then there's this esoteric and energetic testing. So humans are energetic beings, right? We're made of magnetic and electrical energy. We have an energy grid that runs through our body. The traditional Chinese call this qi. If we didn't have a magnetic field, you couldn't get an MRI of your body, right? So we are made of energy, and European physicians and Eastern physicians honor and respect this energy, but traditional American doctors kind of ignore the energy of the human body for the most part. Very gifted practitioners can feel the energy fields around a person's body, but there's also some electrical devices that we can use. One is called the electroacupuncture of Vol. It's like a little probe, like a pen, and you can touch the acupressure points on the patient and feed the information into the computer. You can do muscle testing or kinesiology. This is an energy method. People assess the strength of muscle when a signal is sent in. And then there's a Zyto, which is a little cradle. You just lay your hand in, and it reads the electrical field. Why that is important to a dentist and a physician is that this qi, this energy flow, runs through your whole body like an electrical circuit, including through the teeth. And I can tell by looking at this energy chart where a person might have a medical problem from a dental issue. So the wisdom teeth are energetically connected to the heart. The 2 molars in front of the wisdom teeth, the first and second molar, are energetically connected to the breast and the thyroid gland. So in my patients, if I see a patient with thyroid disease or breast disease, I often ask them to go see their dentist and have a very careful evaluation taken of those molar teeth. When the patient sees a non-integrative or non-holistic dentist, they will often take an x-ray called a bite wing. The bite wing x-rays are taking pictures of the teeth where they might get cavities. And often those bite wings will miss the tip of the tooth roots that can cause infection. And so it's important to work with a dentist that is understanding, and I make sure that the patients say, please get your tooth roots x-rayed. So with that, that's all I have to share with you all today. And
that's awesome. That was awesome. Also, I was going to mention about the x-rays. If you can see a dentist that has a 3-dimensional x-ray, because you can see so much more on there. If there's you can catch something much earlier. Like you're saying with the, if there's a problem in the bone around a tooth root, anyway, you can just see so much more.
So Dr. Campbell, we do have a question. How do you get your physician and your dentist to start collaborating in the way that you and Dr. Amy do?
I think the first thing is to just ask them. Ask your doctor if they will call your dentist. Ask your dentist if they will call your doctor. And be educated enough to speak the language of both professions, because if you learn some of the vocabularies we shared with you today, you'll start to have a heightened understanding of each other's profession, and they're more likely to meet. So I think the honest answer is you have to ask.
Okay. And then one final question is the lab tests that you mentioned, and you mentioned one or two that you alone or you're not many people do them, but are the others like the FAIHM standard test or something special we need to ask our doctors to run for us?
They are standard in the world of integrative medicine. They are offered by a standard laboratory like Quest Labs does them. But you have to have an educated practitioner to be able to know to ask for them. And the FAIHM is our sort of branded name for it. It's not called that by the lab. It's called inflammation markers at the lab.
Wonderful. Well, thank you so much, Dr. Campbell, for this educational presentation and discussion. And you made it so easy for us to understand it about how the oral health really does impact the whole body health. So thank you.
It's been my pleasure. I hope your audience learned some things today, has some new vocabulary and some new questions to ask their doctors and their dentists on their next visit.
Definitely.
I know I did. I learned something every time. Thank you.